Introduction. Occupational therapists develop individualized intervention plans for their clients every day. Using clinical reasoning, the practitioner is able to determine which activities will enable clients to reach their goals. In community practice settings, the occupational therapy practitioner utilizes the same skills and applies them to the context of a community. Designing and implementing a program requires a similar thought process using reasoning skills to develop goals and objectives to implement a program. Many of the skills from practice with individuals can transfer to community practice. Yet, program development requires an occupational therapy practitioner to use systems approach instead of a traditional individual patient model. A general overview of program development and the needs assessment process was provided in Chapter 5. Details regarding developing a mission statement and implementation plan with goals and objectives are shared in this chapter. Strategies for recruiting participants, developing teams, and establishing partnerships are reviewed. In addition, recommendations for budgeting, program management, and program sustainability are presented. The strategies described in this chapter utilize a systems approach based on the occupational therapy practice framework and clinical reasoning models. Mission statement. At this point in the process of developing and implementing a program, the occupational therapist should have a clear understanding of the community and the type of program that should be developed. The practitioner should review needs assessment data to ensure that the program has a clear focus. Often, program planners will compose a vision statement prior to development of a mission statement. A vision statement outlines the ideal state or ultimate level of achievement to which an organization aspires. A mission statement is an organization's core and underlying purpose or basis for its existence, focus, and actions. Companies and organizations that utilize mission statements to guide employees in an overall plan and to make consumers aware of the purpose of the company. A mission statement goes beyond simply educating workers and consumers. It acts as a driving force or motivation behind decisions, actions, and program development. Mission statements also imply future direction, indicating what the program hopes to accomplish over time. When an organization is working in the community, the mission statement should be collective and inclusive of those the program will serve, including community members, and developing the mission statement is one strategy to ensure buy-in to the program both at its inception and in the future. The challenge to developing a mission statement is to describe a program and its values, purpose, and future direction in a few short sentences. In creating a mission statement, the occupational therapy practitioner can follow these best practices. Number 1, do some research. The occupational therapy practitioner and any team members assisting in developing the mission statement should begin with finding current mission statements of organizations that the practitioner admires or believes are easy to understand. Mission statements can easily be found on websites or in company materials. For nonprofit organizations, the practitioner may want to explore existing mission statements of other nonprofits as a starting point. The United Way can be a useful resource for identifying local nonprofit organizations. Number 2, a mission statement is not a resume repeated. Its purpose is not to provide accolades to the past successes or identify the reasons why the program was started. Instead, the mission statement should focus on the values and the premise of the program. Number 3, avoid emptiness. A mission statement devoid of values lacks substance. The mission statement should be thoughtful and meaningful. It should elicit feelings of passion and offers an opportunity to articulate that passion for the program to others and those being served. Number 4, keep it short. Mission statements should be a brief snapshot that captures the essence of a program or organization. Ideal mission statements are captured in a few easily recalled sentences. Number 5, be discipline specific. Professional identities guide values and are certainly relevant to the mission statement. The only caution here is to avoid jargon that might confuse people not familiar with occupational therapy terminology. Number 6, write clearly and concisely. The occupational therapy practitioner should consider the literacy level of the audience when drafting the mission statement. Careful editing is important as grammatical errors and syntax errors in the mission statement can detract from the program and its purpose. Number 7, ask others. One of the best strategies to developing a good mission statement is to seek advice and feedback. This advice can come from peers or community members. Seeking feedback ensures that others understand the intent of the program, which is the ultimate goal of the mission statement. The occupational therapy practitioner can ask the following questions to help them evaluate the mission statement. Does the mission statement reveal the values of the program? What future direction does this mission statement indicate for this program? Does this mission statement inspire? Why or why not? Answers to these questions can provide feedback on the clarity and relevance of a mission statement. Number 8, do not settle. Continue to revise the mission statement until all parties are satisfied and passionate about it. When designing a program, it is important to be thoughtful about the mission statement, as it is often one of the first aspects program participants may view. Furthermore, since this mission statement is included in reports and grant proposals, it needs to be representative of the program. Taking the time to ensure the mission statement clearly reflects the program can aid the program's sustainability. Following the aforementioned best practices will aid the occupational therapy practitioner in developing a relevant and meaningful mission statement for the program. After the mission statement has been established, the next step in the program design is to develop an implementation plan that includes the program goals, objectives, and activities. Implementation plan. Traditionally, when designing and implementing a program, the occupational therapy practitioner considers what will make the program work and also be sustainable. This thought process aids in the development of a structured and relevant implementation plan. An implementation plan includes the goals, objectives, activities, and desired outcomes of the program. The plan should also identify who will be served by the program and how the individuals being served will be recruited. Program qualifications should also be included that describe how and why an individual qualifies for a program and how an individual enters the program once qualification is determined. Development of an implementation plan is important to identify specifically how program goals and objectives will be realized. The program plan provides a holistic approach for identifying the program's purpose, program design, and implementation in one succinct document. According to Brownson, an implementation plan spells out the details of a program and specifies who is responsible for each procedure and activity. In the implementation plan, the details of who, what, when, where, and how need to be finalized for the program. The implementation plan usually contains a timeline and persons responsible to address these goals to reach the program outcomes. An implementation plan allows the practitioner to map out the entire program in an effective and pragmatic manner. After completion, the implementation plan can be distributed to employees or even used for writing future grant proposals. Effective implementation plans help to ensure program success and sustainability. Table 1-6 outlines a sample program implementation plan. Program implementation also requires thoughtful planning in order to maintain focus and ensure that the activities are completed in a timely manner. Many organizations now use strategic planning for program implementation. Strategic planning is a common method, and facilitators with expertise in strategic planning can be hired to assist the process. Ideally, implementation planning should be completed in a group environment to promote communication among team members, especially if a program is new and in development. Implementation planning provides an opportunity to clarify who will do what and when it will be done. Creating a document that outlines program activities ensures that all team members stay on track, communication flows smoothly, and the program goals and objectives are completed in an efficient manner. Implementation planning also allows the program team to plan and anticipate challenges in a proactive manner, which can impact program success and sustainability. Program goals and objectives. In program development, a goal is defined as a statement of quantifiable, desired future state or condition. Goals are written to be long-term and future-oriented, indicating a desired outcome. Goals capture intended outcomes of a program, while objectives are more specific, identifying how goals will be met. Objectives are measurable, short-term, and usually contain a timeline for completion. Goals and objectives are different but complementary. Goals and objectives should indicate the program's priorities, the program's intended outcomes, the community's priorities, and the evaluation plan. A program can have multiple outcomes, but should have a defined focus and prioritize the outcomes. Too many goals and objectives can make a program appear incoherent and disconnected, and poses challenges to successful completion. Drafting goals and objectives that are difficult to achieve makes the program appear disjointed and infeasible, which impacts program sustainability and the ability to garner support for the program, especially financially. Occupational therapists are familiar with goal and objective writing related to intervention planning, but writing goals and objectives for a program requires a different perspective. Writing goals and objectives for a community program requires occupational therapy practitioners to think broadly and envision an overall outcome. In medical model patient care, the focus of goals is to enhance the well-being of an individual. In program planning for community practice, however, the focus is population-based, identifying how intervention impacts a group of individuals. In community settings, occupational therapists need an expanded thought process that incorporates a population-based approach. Although this aspect of goal writing can be challenging, the process of goal writing is similar to that in other practice areas, just applied more broadly. The mnemonic SMART can aid in writing appropriate program objectives. SMART stands for specific, measurement, attainable, relevant, and timely. Program objectives should be specific to the program, identifying a measurable outcome. It is important that objectives are attainable and feasible, considering timelines, resources, and staffing. Goals and objectives should also be developed with a targeted population to be served in mind, and with a focus on the community needs gathered in the assessment. Written goals and objectives should align with community needs and wants to ensure success in meeting these goals and objectives. This concept follows the occupational therapy principle of client-centered practice applied to a program model. Goals and objectives that focus on community needs facilitate community buy-in and programmatic success. The SMART approach is useful not only when drafting objectives, but also when evaluating the match between objectives and program activities. After drafting the goals and objectives, specific activities should be designed that address the goals and objectives. The program activities are specifically what will be done in the day-to-day activities of a program. Similar to therapeutic activities used to reach client goals, program activities are meant to achieve the desired program outcomes. Another essential component of program planning beyond the goals and objectives is to identify programmatic roles. In the planning stage, the details of who will complete the program roles and responsibilities may not need to be identified, but the thought should be given to the potential roles and responsibilities required to make a program a success. Drafting job descriptions for both employees and volunteers provides program structure and ensures successful implementation. Timelines should also be discussed and developed. Including all of these impacts in implementation plan will ensure a stable and sustainable program design. Such a plan guides implementation and ensures that the program remains aligned with its mission and purpose. The implementation plan can be tied clearly to the evaluation plan and used to aid in garnering funds, such as grants. The plan should be dynamic and flexible enough to change, but sufficiently stable to act as a roadmap for program implementation. Participant recruitment. A key aspect of successful implementation is the recruitment of program participants. Recruitment and retention of program participants must be considered in the planning process and is crucial to program design. Inattention to this step can negatively impact the use and success of the program and ultimately not meet the community's needs. Establishing referrals requires the development of protocols and roles for each person involved in the program. The development of policies and procedures for staff was already discussed. However, a policy and procedure should also be developed for recruitment of program participants. The recruitment and referral policy and the procedure outline community members will access and benefit from these services. If there are requirements or stipulations for admission to the program, these need to be identified. The target population should have been identified in the program development stage. Here, the practitioner is planning how to recruit participants, including qualifiers for program participation and marketing to potential clients. In some cases, this step may require developing a marketing plan to identify methods of recruitment. The marketing plan may be referred to as the community awareness campaign, depending on the program and target audience. Whatever the title, the marketing of services needs to be considered in program design. When marketing, the occupational therapy practitioner should consider all necessary venues and utilize community resources such as partners, advisory boards, coalitions, and community members and participants. In the marketing plan development process, the occupational therapy practitioner should take into account the services being provided, who will benefit from these services, and who needs to know about the services. For example, a nonprofit that offers a health equipment recycling program provides used health equipment to individuals in need. The main targets for marketing of this program are social workers, physical therapy practitioners, and occupational therapy practitioners. These individuals refer many clients who cannot receive health equipment through insurance and have been a successful target audience for the organization. Marketing or community awareness should be a thoughtful process because without customers, the program will not be a success. Location and space issues. In addition to marketing and recruitment of program participants, location and space for program implementation are also issues to be addressed in program development. For some, these will not be issues because the program is part of a larger organization that will donate or loan space for the program implementation. This is the case for program implemented into a hospital practice setting where meeting rooms may be available for a community outreach program. Often these spaces will be free of charge if a case can be made to administrators that the program benefits the institution. Program managers may need to make a formal request for such space and should follow the policies of the institution with which they partner. When designing a program, space and location are critical factors. If a paid space is necessary, it will be important for occupational therapy practitioner to consider this when budgeting and determining program cost. The program manager will need to work with a realtor to find an appropriate space and location for the program. Collaborating with other institutions in the community may be of benefit, allowing for a shared cost of space. For example, faith communities may be willing to donate space for health programming that benefits their constituents and the greater community. Local nonprofit agencies may also be willing to share space or provide space at a reduced cost in exchange for lower fees for participants or just as goodwill to the community. Organizations that donate space can identify this as an in-kind donation, which may benefit the organization. If lobbying an organization for space at a free or reduced cost, the occupational therapy practitioner should consider the benefits to the organization and be able to articulate them clearly. If necessary, a memorandum of understanding or a formal contract may need to be drafted to establish an agreement about the space and its use. When considering a space for implementing a program, the program manager has to consider the needs of program participants. The program manager should consider liability issues, accessibility for participants, and the regulations and use of the space depending on the program needs. Related to liability, insurance to cover the facility is important and should be included in the program budget. For program success, accessibility to the location and space are important. When considering accessibility, the occupational therapy practitioner needs to consider the program participants. For example, if program participants are not able to drive, then considering a location close to public transportation is important. Beyond access to public transportation, the occupational therapy practitioner needs to consider accessibility to the space, including ramps, elevators, accessible entrances, parking availability, and lighting. Locations such as faith communities may not be accessible as other public facilities, so it is important to consider these factors when choosing a location for the program. Last, maintaining the space is important to consider in program planning. For example, if the space needs regular professional cleaning, then this will need to be considered in the budget during program planning. Each location and space will come with regulations, and it is important to consider these in planning and in budgeting. Furthermore, the amount of time the space will be used is important to consider. In initial stages or with program growth, a change of space and location may be needed. It is important to consider the impact of such a change on both participants and program implementation. Where to implement a program will also depend on the needs of the program and should be given thoughtful consideration during the planning process. Once a program has been implemented, challenges with space and location may arise that need to be considered. One method for strategizing is to build an assessment of space and location into the program evaluation plan to continually assess the benefits and challenges of the place and location for the program. Supplies and equipment. Each program will have a need for unique supplies and equipment. During program planning, brainstorming a list of supplies and equipment is critical to ensure the program has what is required for successful implementation. Most programs require similar basic needs, such as computers and office supplies. However, programs will require specific supplies and equipment based on the program demands. For example, in a grant-funded program using sensory rooms for suicide prevention for Native American youth, funds were used to purchase equipment to develop the sensory rooms along with office supplies. Garnering supplies and equipment may be similar to garnering funds. Supplies may be donated or equipment may already be purchased by an organization that will allow its use by a program. Otherwise, in the program development phase, the needed supplies and equipment will have to be identified and included in the budget. Staffing and personnel. The greatest resource of any program is the staff who make the program a success. When developing a program, it is important to consider what staffing and personnel are needed for successful program implementation. It is important to recognize that what is ideal for a program may not be feasible, and staff may be responsible for multiple roles. An occupational therapy practitioner may play many roles in a community setting. For a small program, the occupational therapy practitioner may be the program manager and the program evaluator. In a larger program, staff may be hired for specific roles in program management. It is important to analyze what staff members are needed for the program to be successful. If the program has a large budget, then a bookkeeper will be critical to help maintain records. Administrative and support staff may also be of benefit to help with appointments or other basic administrative tasks. If traditional occupational therapy services are offered and billing is necessary, then a staff member trained in billing and coding may be necessary. If the program experiences growth, then more staff may be needed. Along with identifying and hiring staff, it will be important to set up an infrastructure for evaluating staff in order to ensure that personnel are successful in their ability to engage in their roles to make the program run smoothly. Staff members should be clear on expectations and their role in any paid or volunteer position. Performance review is important to ensure staff members are functioning in the way appropriate for the program. One way to clearly define staff roles is to develop job descriptions. Job descriptions have multiple purposes. They can be used for hiring, employee orientation, employee supervision, and performance review, and salary considerations. A job description traditionally includes the job title, supervisor, summary of the job duties, and the qualifications needed for the job. When developing job descriptions, the occupational therapy practitioner should start with the mission statement, which helps identify what goals and values are desired in employees. A potential job should be analyzed to identify the qualifications needed of a potential hire. Many samples of job descriptions exist on the internet and can serve as a template for developing appropriate job descriptions for a program. If paid staffing is not an option, volunteers may be another choice in helping to implement a program. The use of volunteers in program implementation is a popular model to leverage resources and build social capital for a program's success. In academic community partnerships, service learning has been demonstrated as one approach that uses student volunteers to help with program implementation. Programs can also tap into other volunteer programs like Senior Corps or AmeriCorps to garner volunteers and aid in program implementation. Compliance with practice regulations. As an occupational therapy practitioner, it is important to consider practice regulations. If using occupational therapy skills to design and implement the program, it is critical that the practitioner follow practice guidelines, including the differentiation of roles between the occupational therapist and occupational therapy assistant. Programs must fall within the occupational therapy scope of practice and always follow the Occupational Therapy Code of Ethics and Ethics Standard 2010. If an occupational therapy practitioner has questions about whether the programs fall within occupational therapy regulations, the state licensure board should be contacted in order to ensure the program is in compliance. In the case that a program is engaged in billing and coding for services, reimbursement regulations should be followed at all times. Startup cost. When beginning a program, it is important to consider how initial funds will be acquired. Depending on the program, startup cost will vary. Prior to exploring startup cost, a well-defined budget should be developed and finalized. When considering startup cost, it is important to consider what is needed to initiate the program and whether these costs will be initial or ongoing. If the program plans on making a profit, then a business loan is an appropriate option to consider. On the other hand, if the program plans on simply making enough funds to cover program cost, then other funding sources, such as grants or donations, may be more appropriate. Funding sources. When considering how to fund a community program, it is important to consider multiple factors, including the following. What is the funding needed for? Whom does the program plan to serve? What funding amount is needed to sustain the program? Multiple funding sources exist, including donations, sponsorships, grants, and fees for service. Funding can come from multiple sources depending on the program. In some cases, an institution may offer a program and cover the cost in accordance with its mission to serve the community. For a small program, such as a yoga program offered by an outpatient facility, the cost may be minimal and the institution may be willing to cover the expense of marketing if occupational therapy practitioner is willing to donate his or her time. Grants are another source of funding for program support. A grant is essentially a sum of funds donated to an organization to cover the cost of a program. The recipient of funds is accountable to the funding agency and has to follow guidelines set forth by it, which often include specific accountability and reporting of program challenges and successes. Grants are typically available only to nonprofit agencies that are categorized with a tax identification of 501c3. Grant funds are available from a variety of sources, including local and federal government agencies and foundations. Grants are also available in various amounts, from very small amounts, such as $500, to millions of dollars, depending on the funding agency. Program development grants are often a source to start a program and are not regarded as a sustainable source of funding to support ongoing program implementation. Programs may also benefit from donations. Donors receive tax benefits when donating to a tax-exempt organization, so this fact should be emphasized when seeking donations. When soliciting donations, it is important to be very clear about the purpose of the funds to target individuals or organizations that have a specific interest in program or participants of the program. Fundraising may be another method for seeking donations for a program. It is important to remember that fundraising and seeking donations can be time-consuming, must be considered when program planning. Sponsorships are another possibility for garnering funds for a program. Typically, corporations are more willing to sponsor events than sponsor a program. When seeking sponsorships, it is important to clearly designate what sponsor monies will cover and how they will benefit the program. Benefits to sponsor should be considered. For example, if a sponsor provides a certain amount of funds, then the sponsor may receive free advertising on the program's website. Sponsorships are another consideration as a source for funding a program or program event. Establishing fees for service. Fees for service are another method to support a program during implementation and should be properly planned and included in the budget. In a fee-structured program, participants are required to pay a fee for services. These need to be realistic based on what the community can afford and what services are being offered. The program team will need to complete a careful analysis of cost and develop a fair and reliable fee structure. Another consideration is how to address the differing abilities of program participants to pay for services. In this case, a sliding scale fee may be an appropriate method for addressing the socioeconomic needs across program participants. A sliding scale fee identifies a program payment based on a participant's income. When implementing a sliding scale fee, records of participants' incomes must be maintained, which requires additional record keeping and bookkeeping for the program as well as processes to ensure confidentiality. Another option is to define a flat fee for program participants that covers program cost. To explore appropriate fees for a program, research should be conducted on what similar programs charge for similar services rendered. This information can be ascertained by contacting similar programs or exploring program fees on program websites. If the program offers a similar service to what's being offered by a local occupational therapy practice, the occupational therapy practitioner may consider charging the same or similar fees. But if the service differs from the local practice, then fees should be competitive with similar programming. Another approach is to consult with an accountant who can provide guidance on appropriate fees to charge. It is important not to have fees beyond the ability of program participants to pay or that are not competitive with similar programming. Fees for service should be clearly outlined for program participants. In program planning, the timing and payment requirements should be established. If adjustments in fees for service are needed, this must be clearly communicated to program participants with adequate time for participants to determine whether they want to continue to receive program services. A rationale for fee increases is often important to ensure that the program participants understand the need for the change. Budgeting. The budget is another important component of program design and implementation. When creating a budget, the occupational therapy practitioner should consider what resources are needed for program implementation. Financial planning and budgeting should be an annual practice for the program, and budgets should be constantly monitored to ensure the program's viability. The operating budget outlines the program's financial plans for revenue, including monies and resources that come into the program, as well as operating expenses to be paid out of the program's budget. When developing a budget, a thorough analysis of cost and income should be calculated. After determining the cost and income, the next step is to consider the balance between the two to ensure that the program at least attains a zero balance or has reserves in place to pay additional expenses. Budgets are planned for the upcoming year as well as a proposed plan of income and expenses of the program. If a program is new, the expenses and income should be recorded for completing the annual budgets in subsequent years. Program budgets should be in constant flux, adjusting to the expenses and income. Budgets usually consist of two major components: direct cost and indirect cost. Direct cost are those items in budget that will be funded by the program's income. Common direct program cost include salary, benefits, equipment, consultants, travel, etc. Indirect cost are those costs required to implement the program, including overhead and administrative cost. Indirect costs are typically held to a certain percentage of the budget to ensure the program can run. Examples of indirect cost include, but are not limited to, rental fees, payment of utilities, equipment depreciation, providing security, and general maintenance of workspace. Budgets can be simple or complex based on a program. A novice in program design and implementation might want to seek external assistance with budgeting. Programs often pay auditors to aid them in determining fiscal viability on an annual basis. Financial advisors are another resource for help in developing and managing a program budget. Team development. Due to its complicated nature, community practice cannot be done in isolation. Community programs require a team approach, making it necessary to create a strong team. Developing a team to implement the program is an important aspect of program design and facilitates successful implementation. Being strategic with team development ensures the program's implementation is not hindered by miscommunication or mistrust among team members. In this situation, the occupational therapy practitioner may lead the team or become a member of a developing or existing team. The team consists of two or more individuals with a high degree of interdependence geared toward achievement of a goal or completion of a task. Teams make decisions, solve problems, develop a focus, and accomplish outcomes. In community practice, the team will include not only the occupational therapy practitioner, but other experts and also community members and community partners. Using a team approach provides different perspectives on program design and implementation, enhances community success and sustainability, and expands expertise and resources. Teams require time to develop, going through a life cycle of forming, storming, norming, and performing in order to become effective. In the forming stage, team members begin by getting to know one another and establishing goals for the team. Team members begin to explore what tasks they will undertake as part of the team. In the storming stage, team members begin to voice their opinions about the team and proposed task. Dysfunction can occur at this stage as team members negotiate goals and team members' roles. However, this negotiation process is normal for a successful and effective team. During the norming stage, team members come to an agreement about the expectations for the team and its members. Trust begins to develop and team roles become clearly defined. In the performing stage, the team is able to complete goals successfully and effectively. The team is able to work together without conflict towards the team's goals. The stages of team development are described in Table 6-2. Key activities of a team include communication, decision-making, delegation, and problem-solving. These activities should be collectively accomplished in the collaborative model of a team in order to successfully design and implement a community program. Yet, working in a team is challenging. According to Patrick Lencioni, the author of The 5 Dysfunctions of a Team, teams become dysfunctional when there is an absence of trust, conflict, lack of commitment, and inattention to results. These factors can destroy a team, which ultimately destroys a program or the ability to address community need. The team should be aware of these challenges and develop plans to remedy them as they arise. A program team will look different for each program, but having a collaborative and cooperative team can lead to success and ensure the program operates successfully. When building a team, the occupational therapy practitioner needs to identify who will be involved and when these individuals must be involved. In some cases, bringing people in too late can be detrimental to the team and ultimately the program implementation. Next, the team members should collectively define their purpose and goals for the program. In this process, the team members will communicate and begin to build trust with one another. Team members should take time to identify what each brings to the group. This activity will help in building trust early and in delegation of activities later. Group process is an important component of a team's development. Occupational therapy practitioners can use their expertise in group processes to aid in team development and sustainability. In a team or group setting, power is shared. When working in a community program, this is an especially important aspect to emphasize. In the case where community members may be working with educated healthcare professionals, community members may feel inadequate, leading to a lack of active participation. The team leader can identify the strengths and contributions of each member in initial team-building activities and publicly recognize members for what each brings to the effort. Teams should celebrate together. The focus of a team should be not only to address the needs, but also celebrate when the challenge has been successfully tackled collectively. Taking the time to celebrate is crucial to ongoing commitment and making team members feel rewarded for their participation. Teams need ongoing development and care, especially if members of the team change. Group dynamics always come with challenges, but overcoming these challenges is possible. The processes of the team need to be clearly defined, including communication, decision-making processes, and problem solving. One suggestion is to develop a dynamic team commitment where team members identify each of the processes for the team to be successful. In this commitment, all members of the team agree to how the team and its members should function, ensuring buy-in and dispelling common team challenges. As a team changes and develops, the team must revisit its purpose and mission frequently to ensure success and effective outcomes. Establishing partnerships. In community practice, it is rare that a program occurs without connections to other similar or complementary programs. Besides building a team of individuals to implement the program design and implementation should include building community partnerships. Community partnerships are an effective method for developing successful community programming. Partnerships are entities formed between two or more sectors to achieve a common goal that could not otherwise be accomplished separately. Partnerships can also help with marketing and recruiting participants that may be connected with other programs. Collaboration is the foundation for partnerships, and successful collaboration is fundamental to a partnership's success. Occupational therapy practitioners already understand the concept of partnership as discussed in literature related to client-centered practice. In these discussions, the practitioner is in partnership with the client to ensure the client's therapeutic goals are addressed. Community partnerships maximize resources by utilizing the strengths of a mobilized group of people. In many cases, one program cannot alone address a need, but in collaboration, community needs can be addressed more efficiently. Furthermore, partnerships created to address health-related issues can aim to create a seamless system of relevant healthcare services for the community. Partnerships form between groups or organizations. Occupational therapy practitioners can be involved in multiple ways in community partnerships through academic community partnerships, community coalition membership, advisory board membership, nonprofit board membership, or simply as members of the community. Community partnerships in themselves can be complicated to develop and maintain. As with the development of any team, a significant investment is required to develop trust and relationships and face the challenges necessary to collaborate effectively. Research has shown that developing and maintaining partnerships takes time, commitment, and open communication to develop the mutual trust required for a true exchange and partnership. The occupational therapy practitioner included in collaboration will need to commit the time and problem-solving abilities needed to be an effective community partner. Partnerships can be very formal or very informal, depending on the partners involved, the community need, and the program. If partnerships are formal, then the partners may develop a strategic plan identifying goals and objectives for partners based on the program's mission. Formal agendas and meeting minutes should be maintained to track partners' efforts. In some cases, this documentation may be a part of the program's evaluation plan and may provide valuable information for a grant report. Granting agencies that require partnerships will want documentation of the success of the partners in reaching their goals. Developing community partnerships requires commitment. Occupational therapy practitioners can play a critical role in community practice using their expertise in occupation. However, it is important to remember that there are many aspects of developing a community partnership. Partnerships should be thoughtfully developed and maintained, especially if a community is underserved. And once a partnership is developed, it needs to be maintained. Program management. Programs are important to the communities they serve. In order to sustain programs and ensure they meet the community needs, community members should be actively involved in the program. When designing and implementing a program, the practitioner should consider how the community members will be involved in monitoring the program. Advisory boards are a model for including the community in the program implementation and maintenance. Advisory board is a collection of community members who provide feedback to a program. These individuals may be community stakeholders and/or community members. The advisory board is a resource to the program team and connects the team with the community members. Prior to convening an advisory board, time should be taken to establish the role of the advisory board, the goals of the advisory board, and a description of the role of members on the advisory board. Advisory boards usually consist of experts who know the community and the organization, so the individuals can make recommendations and guide the organization or program. An advisory board demonstrates quality assurance, and the organization is listening to the voice of the community. When inviting individuals to participate in an advisory board, the leader of the advisory board needs to ensure that participants are individuals who will provide constructive and critical feedback and also have the time to devote to advisory board activities. Advisory boards typically do not meet often and do not require a significant amount of time, fit when recruiting members. Advisory boards are not the same as board of directors used in a nonprofit model and do not necessarily require the same level of formality. In some cases, a program may have a board of directors and an advisory board, depending on the program needs. A board of directors is a group of individuals who guide the organization in its mission, finances, and programming. Nonprofit agencies follow a model of including a board of directors to aid them in planning and ensuring financial viability for the organization. Each board of directors has traditional officer roles, including president, vice president, treasurer, and secretary. Members of a board of directors are volunteers who have expertise and can aid the organization. The members of a board are fiscally responsible for the agency they support, both in monetary donations and in expert guidance. Depending on his or her role in relation to the board, the manager should know how to work with the board and communicate with board members as necessary. An executive director of a nonprofit organization will work directly with the board, keeping them informed on the organization's functioning and development. Program sustainability. A program's sustainability is crucial and should be part of program design and implementation. Community programs are not meant to be static and are ever evolving. Sustainability is more than simply having funding to continue a program and includes other factors that influence the program's ongoing success. Program sustainability in communities means that going beyond the program implementation to connect with the community and build capacity to ingrain the program into the community. Sustainable community programs are endurable, livable, adaptable, and supportable. Programs terminate for many reasons, including poor or inadequate planning for program sustainability. Sustainability has not been a program priority, the community lacks buy-in or support for the program, or fiscal barriers exist, such as lack of funding or poor economic times. Major problems exist when a program lacks sustainability. In some underserved and diverse communities, mistrust of outside individuals and sometimes mistrust of healthcare in general are part of the community's dynamics. Developing a program that suddenly ends when grant funding ends sends a message to the community that the program was not really created for their benefit. These actions can lead to further mistrust and difficulty in forging future partnerships. When addressing significant health issues in communities, sustainability can appear nearly impossible due to barriers and lack of resources. Yet sustainability is possible if programs are well designed and complement the community's needs and capacities. Successful approaches to sustainability include ongoing evaluation, ongoing service development, program modification to meet community needs and desires, effective program marketing, and use of capacity building approaches. Community programs also need to be flexible to be successful. Community programs should respond not only to community needs, but also to social, economic, and environmental conditions that impact both the community and the program. Community programs are developed to address community needs, and sustainability is more likely when services are modified as community needs and desires change. When addressing program sustainability, the following factors should be considered: effectiveness of the program, the relationship with the community, anticipated duration of the program, funding, and staff expertise. Program effectiveness is determined through an evaluation plan. Evaluation results will reveal if the program is really worth continuing, responds to community needs, or requires changes to be effective. In the case that the program is ineffective or the need is short-term, then sustainability might not be relevant. The strength of the program is an important factor to consider. With most health-related community issues, a short-term solution will not be viable. If the plan is to sustain the program for the long term, then goals and objectives need to be put into place to promote and suggest sustainability. If sustainability has not been considered in the initial program development, the program team may need to go back to the drawing board of basic program development and redevelop components of the program for the long term. The expertise of program staff is a very important factor in sustainability, especially because sustainability infers that programs change according to the community. Having staff that are flexible and able to offer expertise in multiple areas related to community issues is important in maintaining successful program. Involving stakeholders from the community or hiring community members to implement the program enhances this aspect. If funding the salaries of staff is difficult, then the program may choose to move toward a volunteer model instead of funding positions. This strategy will depend on the program, the access to volunteers, and the community needs. Obviously, funding plays a role in the ability of a program to sustain itself. Multiple strategies can be considered when exploring financial sustainability of a program. If a program is grant-funded, it must remain sustainable either by garnering outside funds or by implementing a fee for services. If seeking funds from external sources, the program team will need to have a plan in place to either search for future grant funds or engage in fundraising efforts. Cost-benefit analysis should be done to be able to demonstrate to funders and donors the impact of the program and its relevance to be sustained. These strategies for fundraising are many and will differ based on the program's structure and needs. The program team should also be aware of its in-kind services, those that are provided free of cost to the program. Seeking in-kind services can aid in balancing a program budget. Fundraising may seek not only funds, but also services or supplies needed by the program. Fundraising is often the most successful when program staff have developed relationships with potential donors. Sometimes this process is referred to as friend-raising. Developing a sustainability plan. One of the best ways to ensure the long-term maintenance of the program is to develop a sustainability plan. The sustainability plan encompasses an overall strategy for program maintenance that includes specific goals for sustainability along with an action plan to address these goals. A sustainability plan is meant to be an action plan outlining specifically what needs to be done and who needs to do it in order to maintain the program. The sustainability plan is similar to the implementation plan, but is future-oriented, focusing on what needs to be done to maintain the organization's viability. The plan should include goals, objectives, and action steps, including who will do what and the date for accomplishment. All the aspects of this plan should be focused and geared towards sustainability rather than program implementation. Sustainability planning should include identifying the challenges to sustainability. One question to pose is, what could cause the program or organization to not be able to sustain itself? Addressing this question is difficult but essential to the core of any sustainability plan. Identifying the challenges to sustainability allows the program team to develop approaches to effectively address them. Planning for sustainability is an essential process for a program's survival. One approach is to develop a committee or task group focused specifically on sustainability. In some cases, these individuals may be volunteers or members of the program team. Sustainability planning should involve a group of community stakeholders and those who have a vision for the future. This group should include individuals who have used the services and directly benefited from them. Including input from the community members ensures that the program that is developed meets the needs and desires of the community and aids in establishing sustainability. Also, the plan needs to be practical and feasible to ensure success. This means that it does not include raising community fees by an exorbitant amount, nor propose strategies that will ultimately lead to challenges rather than success. The Sustainability Committee also needs to continually search for and garner resources that will support the program. Conclusion. The occupational therapy practitioner needs to be thoughtful in program design to ensure that once a program is implemented, it is viable and sustainable. Program design requires the development of a program's mission and implementation plan. Team building, sustainability planning, and budgeting are important components of program design to ensure successful implementation. Program design requires the occupational therapy practitioner to thoughtfully consider how the program will work, who will be involved, who will benefit from the services, and how the program will be funded. In this process, the occupational therapy practitioner can make a programmatic idea and design a program that meets community needs to impact occupation and quality of life.